I'm Dr. Keeler. I work in our Redmond Ridge location, and I'm a board certified pediatrician. And I went to and a fellow of the American Academy of Pediatrics. I went to UCSF for med school, which is in San Francisco, and Children's Hospital Los Angeles for residency. I'm in my 11th year of practice at Allegro, and I have two kids, two girls, who are adequately nourished most days. And I've done this talk for a couple of years, so it's always been one of my favorite topics. So this is just a general outline of the presentation we're going to do today. Why this topic, and then how development and behavior figure into feeding. We'll define a toddler, talked about the impact of development on feeding behavior. Eating and nutrition, so there's this golden rule that we'll go over and some strategies for implementing it. What to look for if there's more than just picky eating concerns, a brief overview of feeding therapy, and then I hope to have a little time for questions at the end, but there are 30 slides for this talk, so it could be that we come up close to the timeline. So this is, I think, a great topic and hopefully a timely one for the people that are attending today. And, hopefully your infant is feeding well if you have an infant. And but the transition from feeding an infant to a toddler is usually not easy. And it can really catch people off guard how quickly things change. When a toddler starts expressing their own opinions and preferences, it's a defining moment for parents. I think it's not to say that taking care of a baby is easy, but you kind of are running the show on everything. And then when the toddler tries to run the show, it can be kind of like, oh man, what are we going to do about that? And then the thing I really love about pediatrics in general, but especially this topic, is that the timing of information is really important. Like if we can give you the information you need ahead of time, that's great. But it's basically like, if you've fallen into some traps and we give you the right info at this point, it's easier to undo it later on than if you show up with a 3 or 4-year-old that's still having feeding problems. So we're going to talk a bit about toddler development and behavior. So what is a toddler? Who does this sort of apply to, this talk? I mean, some of the principles can apply to children of any age, but basically I'm sort of saying like 1 to 3-year-olds maybe. Fun little definition here. A toddler is a small creature who is only hungry after you throw away the food she refused to eat the first 80 times you offered it to her. And I think hopefully you haven't had too many of those experiences, but basically to toddle is to walk unsteadily. And toddler and terrible twos are sort of like, I think it's just the goal is to kind of summarize that this can be a challenging age for parents and young children. So here's some developmental norms of toddlers, which, if you have a toddler, you've probably started to experience this a little bit. So a toddler is simultaneously exploring separateness and autonomy and getting their first little opinions and preferences, but they still need you a lot too. And so that creates a lot of tension, because there will be times when they totally rely on you and need you to do everything. And then there will be times when they are just going to the mat over something that they want to do. And they have low expressive language skills. So a kid from 1 to 18 months is basically mostly understanding a lot. And they may know a lot of words, but it's hard for them to communicate that back through verbal language. So, they have some ability to communicate, but it can be really challenging to figure out what they want. Also, toddlers and children in general, but especially toddlers, have very poor frustration tolerance. So as adults, we all vary in this a bit, but if our needs aren't being met, we can kind of suppress the emotions that might lead to. And a toddler just does not have that ability. Young children to a large degree don't have it, but toddlers especially. There's this thing that toddlers go through, which is called neophobia, which they have, which is basically, the definition is just the fear of newness or the fear of new things. And toddlers can be really hesitant to try new stuff. You may, in fact, have to introduce a food several times, maybe even dozens of times, before a kid gets up enough trust in it to where they don't think of it as new anymore. It's very normal in both behavior and in feeding for kids to get stuck on familiarity and want to just keep doing the same thing. When it relates to feeding, that's called a food jag. So yeah, goldfish for life, right? And then, they love, they're little limit testers. So they like the word no, and it's not always said in defiance. Sometimes it's just said to see what the reaction is going to be like. Well, last time I said no, something interesting happened. So let's do it again and see what happens. And like I said about familiarity and frustration tolerance, this is a fun one. It's a little old now. When they give you the milk in the blue cup, even though you've told them a million times, never the blue cup. So how do a toddler's development and their feeding relate? So the normal milestones that we just covered, as you can imagine, can directly contribute to poor feeding and parental frustration if you're not approaching it with the right sort of viewpoint on things. And clearly, I think infant feeding strategies won't work anymore. There's this person who I'll reference again, Ellen Satter. She's like the probably the guru of child feeding behavior. And just to quote her, she says, "The healthy toddler is engaging, curious, energetic, and recalcitrant. And if you treat him like you did when he was an infant and simply accept and support his desires, you will fail him utterly. He needs reasonable and firm limits in order to feel secure." And so this talk is about basically how do you set up a healthy environment and how do you set up a pattern of behaviors, and then how do you divide the responsibilities between what your kid is responsible and for what you're responsible for. And that's where one thing that hopefully I bolded this because hopefully it's a good take home is that with infants, you are very much worried, especially in the beginning, right? We pressure parents, hey, your baby needs to eat every 3 hours. And, even if your baby doesn't wake up, you need to wake your baby up for, maybe the first few weeks. And then, when you're starting solids, it's like, okay, we'll finish that meal. The nutrition is really important. You've laid a lot of the groundwork throughout the infant year for this transition to the idea of at any given meal with a toddler, teaching and emphasizing the correct behaviors or good feeding behaviors. It's just about as important as worrying about the correct amount of food that they're eating. And I understand that parental anxiety and concern for toddler nutrition is high. But the good news is that in years of practice in the US, we just don't see malnutrition in the same way that is all too common for people that are coming from developing countries. So don't let nutrition trump behavior in the sense that we shouldn't be force feeding our kids. These are things that I don't think anybody intends to do when they first start feeding their kid. But, these are things that we do see in our office when we take a feeding history. So the use of a very strong distraction technique, so like mindless eating, where, Cocomelon's going and the spoon is just kind of appearing from the side. Straight up force feeding too, where it feels like a stressful, sweaty event, sort of like holding your kid down for shots, right? Does. And thankfully that's not very common. But a feeding shouldn't feel like that. And if it does, I think intuitively parents know that something's not going right. And then, the continuation of overnight milk bottles, which in the early toddler period, like 12 to 15 months, is probably part of the natural transition. But by 2.5, it's hard on the teeth. It's stealing nutrition from the next day. And it's just not necessary to dream feed your toddler anymore. And then, moral of the story is there is another way, which is probably why we're all doing this together today. So Hannah, here's your poll. And I got one too. I can answer no to this one, but I have used a phone or screen time to distract my child while I feed them. This is anonymous. Oh, I can't vote. Okay. This is anonymous, so I will not judge you individually. And I'll just say in past years, I'd say the answers I get are about 50-50 on this one. So are we running this, Hannah?
Yes, it's going.
Okay, great. I guess you'll close it when we're done.
Yes, you should be able to see it now.
Okay. Oh yeah, 40. Okay, so 44.56. So this is pretty similar with what I've seen in the past. And I bet you if, when you first had your baby or you were thinking about feeding your child, you didn't think that this was going to end up being necessary. And I think there is kind of a better way, and that's what we're going to talk about. So let's get to the next slide here. All right, so Hannah already gave a disclaimer, and I'll just give this disclaimer again too, where if you're attending this talk and your child has significant developmental delay or autism, some of this advice may not directly apply. So hopefully your child is getting additional support services, which could include OT, feeding, and nutrition support. So, if I'm talking about like allowing a child to leave a meal hungry or something like that, and you have a child with autism or developmental delay, don't let the bullet point that I'm showing you supersede any advice that your doctor's given you or your therapist has given you. So here's Ellen Satter again, the book, which I think it's $5 on Amazon or at used bookstores. I mean, it was written in the 80s or 90s, but it's still the best read. How to get your kid to eat, but not too much. Ages and stages type approach. So there's a chapter on infant feeding. There's a chapter on toddlers. I think it's called "Is your kid jerking you around at the dinner table?" And it goes on and on all the way up to like grade school, middle school, high school. And her big thing is the golden rule of feeding children, also known as the division of responsibility. So this is what you're responsible for, and this is what the kids are responsible for, specifically toddlers. You're responsible for what's presented to eat and the manner in which it's presented. And then a child is responsible for how much they're going to eat or even whether they eat or not. So this is a little more kind of granular on that. Parents are responsible, obviously, for selecting and buying the food, but also setting a schedule for meals and snacks. Obviously, you need to make and present the meals, and then put the food in a form that the toddler can handle that's appropriate for their development and the amount of teeth they have and their fine motor skills. You should be there and help to try to make the mealtime pleasant and distraction-free. And then you should model and enforce standards of behavior rather than sort of monitoring and enforcing standards of like quantity, and ideally in the form of a family meal. This is what you are not responsible for, according to Ellen Satter, and I believe this too. The amount of food that a child eats, if they eat it all, or how their body turns out. And this is a tough one because we all know as doctors, we see patients come in and we have children with very, very healthy habits that are very small, very medium, and very large. And to a large part, if a child's health habits are correct, you're not going to get a lot of grief from the doctor. Or if you are, I think you need to talk with the doctor and direct the conversation a little bit, which we'll talk about a little bit later. So how do you actually implement this golden rule? So a toddler, which is a little bit different than a baby schedule, you should be aiming for 3 meals a day and 2 snacks. And just kind of accept that they won't eat well at every meal or every day. And if your toddler is hungry between meals, you want to wait until the next scheduled mealtime or snack time. When a toddler says no to all of the food that's in front of them, but then 30 minutes later they're at the pantry door sort of pointing at something, or they've found an item and they're showing it to you like, open this, I want this. If it's not a meal or snack time, you can say no. And that's kind of like the thing I said before, where they need to have boundaries in order to succeed. It is okay, and that's if I would imagine that most people here, your kids aren't in daycare, but it's possible that they are. And that's kind of the way that a daycare would run this too, is they'd have a little toddlers together, then they'd have their, maybe it's a milk time, maybe it's a snack time, maybe it's a meal. And then the toddlers get to see each other and kind of learn from each other too, which is great. So try and avoid handouts and unplanned snacks. There are exceptions to this, obviously, when you're traveling, if a kid's sick, that kind of stuff. But think about having a schedule. It's not the on-demand feeding schedule that you got used to when you had an infant. Prioritize a family meal when possible. I know we have work from home. I know we have, nannies and grandparents and other people helping, or you may just be so busy that you'd rather feed the kid and feed yourself later. But I think it is important to realize that you feed an infant, you feed a baby, you sit with them, you encourage them, you do a lot of the work for them, but ideally you should be eating with a toddler. And try and make the mealtime pleasant. I mean, just sitting there and making conversation, I mean, they may not be saying much back to you, but you're talking to them, you're observing what they're doing and offering them praise and feedback. You can let them feed you little bites. You can offer them bites of your food. And you have to kind of plan that it's not going to be a 5 to 10 minute meal. You have to expect and plan for slowness and messiness if they're exploring food. We were talking a little bit before the talk started about how quinoa gets everywhere, and I have a picture that's in my phone roll from when my youngest was 10 months and I gave her a bowl of yogurt and nothing else. And I just let her eat it with her hands and then took a picture and then did a lot of cleanup. So, I mean, you can tolerate slowness and messiness. And then if behavior's done, like if it's arms back and, more food is flying than it is going in a kid's mouth, then you can call the meal quits. You don't have to wait a certain amount of time. All right. I'm a big believer that I think that a toddler should not be wandering around and eating, or you shouldn't be following your kid around, giving them little bites of snacks. I think they should get used to sitting in the same place, whether it be a booster or a high chair. Or I know some families will have a small toddler-sized table and chair next to the larger kitchen area. And I think part of the wandering and eating thing is also just letting them know that they should focus on the meal that's in front of them, but also a kid's aspiration or choking risk goes up quite a bit higher when they're walking, chewing, and swallowing at the same time. I think most people know this, and there's good access to stuff like this now, but child-size safe utensils and cups are important. And then if you haven't stopped using a bottle by 15 to 18 months, you really should consider stopping. Yes, the milk intake will drop and you're using whole milk at this point. So it's less critical, that milk is less critical in the second year as it was in the infant year. See how we're doing on time. Oh, we might have some time for questions. Texture. So people often ask me, like, what's my child's choking risk when they're eating? And I would say it's actually quite low if the food that you're feeding them is safe. And in fact, I think a lot of toddler and infant choking is often on non-food items away from the infant table. But that being said, things that are hard, things that are large enough to block the airway, large pieces of meat, for example, or, large pieces of hot dog, a whole grape, something like that. They should be either avoided or cut into smaller pieces. Strips are great. So sort of like French fry shape, cutting a pear into spears or an apple into little spears where they can grab one part and nibble little bites off. That's usually a good idea. All right, general nutrition guidelines. So I do not, and I don't think it's in this talk, I don't love toddler meal plans because they really go counter to the behavioral aspect of what I'm trying to promote with this talk. So there are toddler meal plans available, and I think it can give a good guideline, but you kind of almost need to take this average of what your kid is eating over the course of a week, rather than thinking about, oh, at this meal, they were supposed to have 8 ounces of dairy and they only had 6. So now we're 2 behind. That you just don't have to worry about it to that degree. But if you really just don't know where to start, like, I don't even know what size portion to provide, start with about 1/4 of an adult portion and you can adjust from there. I was talking with a family yesterday, and one meal, their toddler ate as much as mom. And it was just like, mom was simultaneously proud and freaking out, like, is this okay? And I told her it was okay because it was healthy food. The sample diets, like I said, you can look at them to get a like sort of a ballpark, but don't follow them like you might as an adult if you're doing a diet plan or you're following an exercise related nutrition plan. You have to be flexible. Ballpark for calories per day is about 1,000 to 1,400. Fat is a very important part of toddlers' diets. It helps with their developing brains and the way that neurons are wrapped with the fatty layer. And so you never have to worry about fat content. So whole milk yogurt, whole milk cream cheese. You can add olive oil things. You can butter things. A toddler, I'm sure you could get too much fat as a toddler, but it's pretty hard to do. Babies or toddlers need about 8 to 20 ounces of dairy. Eight's probably, I'd consider kind of a minimum. 20s, you go past 20 and you're starting to get diminishing returns. And then most kids, most toddlers in the Pacific Northwest are gonna need to stay on vitamin D. If they were taking formula as infants, they got it through their formula, and you'll need to start 400 units. If they were breastfed, hopefully they were already getting 400 units a day. All right, so I just really love this one because this is, I think, feeding going well, I guess. Bring me another Smurf or Smurfs. So so if you come into your checkup and you're like, you know what, I just don't think my toddler is eating well. We need to know that, because before we come in the room, we're going to look at the growth chart and we're going to kind of make a guess based on how we think feeding's going, based off what their growth chart looks like. And we can be guilty of saying things like, no, look, the growth chart's fine, your baby's doing fine. But when you dig into this, what I've learned over the years is that some of the best eaters, so kids that have all the right behaviors, can just have really bad growth charts, like they're super skinny, or they haven't gained weight since they were like 9 or 12 months because they started crawling, they started running, and genetically the family's a little smaller and they were chubby little babies. And then you can have sort of a quote unquote perfect growth chart, but the kid just isn't eating. So you're dream feeding or you're force feeding or Cocomelon is feeding them. And so we need to come to an agreement as a patient, for you guys as a patient, us as a doctor, to figure out if things are okay or not. But you may need to redirect the conversation or admit to some embarrassing strategies. And we have heard just about everything. So you don't have to be too embarrassed about it. So most of the time, toddler feeding problems are not due to a medical problem, but sometimes they are. For example, reflux is a really common one, or you can have intestinal disorders that can cause weight gain and feeding problems. We mentioned before the developmental delay and autism spectrum are conditions that can impact feeding, and the division of labor does not always apply in these situations. Hopefully, those children are receiving the services that they need. Basically, the goal of this slide is to say your pediatrician will help you figure out if the content of this talk is going to work for you guys or not. So feeding therapy, what is it and where can you get it? So usually it's provided via the birth to 3 centers, such as for Lake Washington, Kindring, for the Valley, like Duval and Carnation and Compass. Up north, I'm less familiar with the resources, but I know that Kindring goes at least as far north as like Bothell, Mill Creek. And then basically a feeding therapist assesses the patient. And most of the time, especially now that COVID restrictions have eased, therapy sessions occur in the home, usually weekly. And most therapists are going to take a play-based desensitization approach to increase food acceptance, decrease pressure, and then respect and work with a child's reaction to a food. Like this is sort of like those little army the fireworks that shoot an army guy up and they go up super fast and make a big noise and they go down real slow. Like feeding problems can come on really, really fast. And usually, unfortunately, the solutions to them are usually very slow and they happen over the course of weeks to months. So here's a little summary, and then it looks like we have about 5-6 minutes for questions. typical normal toddler behaviors can directly lead to picky eating. Feeding behaviors in the golden rule are as important as the right amounts. If feeding is not going well, feeding therapy is a great option. And talk to your pediatrician. I think that the pediatricians are literally your single best resource and ally for addressing feeding related issues. So some resources, your pediatrician, obviously. Healthychildren.org is the AAP's website that has most of the patient and parent facing information, and it's divided by ages and stages as well. The book that I prefer is How to Get Your Kid to Eat, but Not Too Much. And the AAP author wrote Food Fights as well, and it's good. It's certainly, I think, the stuff that resonates with me a lot more is the stuff by Ellen Satter, but certainly there's other good resources out there as well. So that is it.
All right. Thank you, Dr. Keeler. We have a few questions here about picky eaters.
Sure.
So toddlers who won't eat anything except for their favorite foods, but if their favorite foods aren't offered, then they're complaining about hunger.
Mm-hmm. Yeah, so that is a really common problem. And I would say that this kind of goes with the food jag thing. And when a child is in a food jag, I think the most important thing that you can do is don't overwhelm them by giving them a plate of food that's completely unfamiliar, because that would very quickly overwhelm a baby or a toddler, and they just would kind of give up on the meal, like, what are you doing to me? So the best things you can do when you're dealing with a food jag is be patient. Continue to offer non-preferred foods alongside preferred foods, and continue to eat those non-preferred foods with your toddler at the same time. And don't give up on it, because these same kids that go down and narrow their favorites down to maybe 6 to 8 foods, basically they will come back. And I think the old research from the 80s and 90s shows that it can take up to 50 times of offering a food or reintroducing a food before it starts to be preferred again. Another one I love for this too is if you have friends that have a toddler that's a good eater, like a toddler they're starting to notice what other kids their age are doing, and scheduling a play date with, like, a garbage disposal friend or something that will just eat anything is a good idea too, because if that toddler sees someone else their age eating it, the likelihood that they'll accept it in the near future is a little bit higher.
Great, thank you. Another question we have is about healthy versus bad fats, and if you have any recommendations for healthy fats for your toddler.
Yeah, I would say most of the plant-based fats, so like olive oil and things like that, are good. Dairy fat is generally thought to be pretty good. And I would say the only fats that probably aren't as good for a toddler would be like just, very fatty cuts of meat or ground beef and stuff like that. But egg is fine for kids. Whole fat dairy is fine for kids. Avocado, peanut butter, assuming there's no allergy. The plant-based oils, those are all great.
Great, and then we'll do one last question here. We had a few people asking about transitioning away from bottles.
Yeah,
and
I saw
if you
sippy cup questions. Yep.
Yeah, if you had any recommendations for sippy cups, straw versus no straw.
Yep, I like straws for kids this age. They're just way more efficient than, tippy cups. I would say something that's sort of like you tilt it back and it has to come out through a flow restricted hole. Those are pretty frustrating, and I'd say that they're more for the portability and packability than something to use around the house. Something that's becoming more popular, which I think I can get behind this, is just using small, like sort of like, like the dentist or like we have in our offices, the little paper cup size. You getting those in silicone cups and just allowing a child to sort of like tea party style, just sort of like drink small amounts from that. And I've seen actually infants that can learn to do that too. So I'd say probably straw, stay away from tippy style. And then the straw ones, they do have some good options where they're packable, but then you press a button and the little thing flips up. We use those for milk and water for our kids. And then, yeah, maybe a little bit more towards the little small silicone cups.